Focus. Ideate. Innovate. Enable.
Presented by Bain Capital.
Hello and welcome to Mindmine Mondays, a special conversation series where we catch up with eminent thought leaders from diverse fields to discuss the emerging realities of our times and their impact on our present and our future. Today, our focus is on the healthcare sector, and we're going to be talking about the pandemic and beyond, and the need for India's healthcare sector to undergo a complete reboot. So without further delay, let me welcome my first guest today, Sunil Kant Munjal, the chairman of Hero Enterprise, who also likes to personally curate these Mindmine Monday conversations. Mr. Munjal, thank you very much for joining us today. First up, I want to begin by asking you, most of us know you as an auto sector veteran, but of course, Hero Enterprise also has some interests in healthcare. Has the pandemic brought about any interesting investment opportunities for you in the healthcare space? Are you eyeing any innovations at this point in time?
So that question is a surprise. But yes, as an active investor, we have looked at health as an opportunity. As you know, we are both involved in not-for-profit health in DMC, Dharan Medical College and Hospital, which is one of the largest teaching hospitals in the country now, which is also focused on research and nursing college and a medical college. But as an investment office, we do look at health as an opportunity. And we do have some investments, especially overseas, in medical devices in California, the cancer drug discovery. And our team is currently looking at where the need and opportunities lie right now. But let me first thank you, Mridu, for anchoring this session of Mindmine Mondays. As you know, Malcolm Forbes once said, true vision is insight. And this is what we at the Mindmine Institute try and do, is to provide insight by talking to experts, subject matter experts, and looking at something like, at this moment, a big cathartic event that we are all facing. But since we could not do the physical Mindmine Summit, which we do every year in April, we are doing this through what we call Mindmine Next and a series of sessions called Mindmine Mondays. Today, I'm delighted that we could get such top-class experts, such as Dr. Srinath Reddy, who is the president of the Public Health Foundation of India. And public health, as we know, is one of the subjects and themes that's actively being discussed and debated right now. We also have Dr. Priya Sampathkumar, very respected voice in this field, and is leading the initiatives on research and ideation on how to address the COVID-19 situation, not just in her institution, but also worldwide. I also want to offer a very special thank you to Dr. Poonam Khetrapal, who is the South Asia head of WHO and a former bureaucrat and a thinking individual who I think is the absolutely perfect person to have on this conversation to discuss where we are today and how do we go forward in this. And to moderate the session, we have Dr. Ambrish Mithal, who is the chairman and head of Endocrinology and Diabetology at Max. He's an old hand at this, one of the most respected voices in India in not just the field of diabetology, but also on healthcare in general. Big thank you to all of you. Big thank you also to CNBC for partnering with us on this series where we bring in issues that matter. We've looked at things like hospitality, jobs, economy, and today we are addressing something which is close to everybody's heart and mind, is how do we get through the current situation and where will we land up once we are through this? So thank you very much, Mridu, for that question.
Thank you, Mr. Munjal. And Priya, I want to begin by talking to you. First of all, thank you very much for joining us so early in the morning from the US. Thanks for taking our time. I know it's a very, very busy time for you. First up, purely from a science perspective, this is a very fascinating virus, a virus that has left most of the medical community across the world confounded with its erratic behavior. So far, we know that it's highly contagious. We know that it affects the respiratory system the most. We know that persons with serious health conditions, prior health conditions, are more likely be impacted by the virus. It has mercilessly claimed lives across the globe. What new have you discovered over the last couple of weeks as far as this novel coronavirus is concerned, and how is it really different from all the previous coronaviruses that we've seen?
So I think the most important thing about this virus is that no one in the world has been infected by this virus prior to this outbreak. So essentially, you have the entire world's population susceptible to the virus, and that's what makes this so dangerous. The other thing about this virus is, yes, it's a respiratory virus. It enters our bodies through the respiratory tract. But as time goes on, we're learning that it can pretty much affect every single body system. So you have a pneumonia from the virus. You can have inflammation of the heart and consequences from that, including heart failure and arrhythmias, where your heartbeat becomes very irregular. It appears to affect the GI tract and can give you diarrhea, nausea, vomiting. It affects the brain and can give you encephalitis, memory disturbance, confusion, delirium. So it really appears to be a virus that can go anywhere. The other thing that we've realized is that it can give you unusual skin rashes. It can also give you increased risk of clotting. So it causes so many different issues with different body systems that it is a very unique infection compared to every other kind of coronavirus you've seen. Most prior coronaviruses were really, gave you a minor cold, did not make you very sick, primarily happened in children. By the time people were adults, most people didn't have any significant problems with it. So both the fact that we have a large population that's non-immune, the fact that it can cause very severe illness in some people, including death, and the fact that it can affect every body system, giving you a multi-system illness, is what makes this so unique.
Right. And if I can just bring in Professor Reddy at this point in time. Professor Reddy, can you hear me loud and clear?
Yeah, I can hear you well. Thank you.
We are at over 67,000 COVID positive cases as of today. But how does one really measure the real extent of this pandemic? The eventual goal is, of course, to minimize the loss of lives. But even as testing gets ramped up every day in this country, there are asymptomatic patients, there are the ICU numbers, there are the hospitalization numbers, there are the numbers of the deceased. What is the real extent of this pandemic, and what sort of an exponential increase are we expecting over the next 2-3 months as we slowly lift up the lockdown? Are we really ready to see an exponential rise?
Well, basically, we'll have to look at a multi-dimensional picture, at least a 3-dimensional picture. Firstly, imagine a triangle. At the base of the triangle, which is wide, are a mix of people who are infected and asymptomatic or very mildly symptomatic. Then in the middle of the triangle, you have people who have influenza-like illness and may need to be detected by what's called syndromic surveillance, in which symptom-based surveillance is done by household visits or by telephonic contact. Then at the top of the triangle, you have people who are actually getting admitted to hospital with serious acute pulmonary infection. Some of them, a few of them will die, but many of them will require care in hospital and will recover and get discharged. Now we need to find out the dimensions in each of these areas. Now, as far as the bottom of the triangle is concerned, it's difficult to test everybody, particularly when many of them are going to be asymptomatic. But you could do random sampling antibody surveys in district level, and then try and gauge to some extent what the level of the spread is, though there are likely to be some false positives with antibody tests. In the middle, you can actually do syndromic surveillance based on symptoms and try and identify people with influenza-like illness, as I said, through household or telephonic surveys, and those who report such symptoms can be tested with antigen testing. then those who are actually admitted in the hospital are going to get tested anyway, and we get full measure of all the three dimensions that way. But we should not get too panicky about how we are actually measuring this epidemic in terms of the spread, because ultimately the objective is to reduce the number of deaths. And when we do that, we recognize that if you take deaths per million population,
Right.
we are at the moment having 1.27 deaths per million population, whereas countries which started along with us at the moment have actually gone ahead. The UK, Sweden, and others have gone into hundreds per million population.
Right.
So in that sense,
I am Professor Reddy, going to come back to you on that bit about what various countries have been doing. But let me also bring in Poonam at this point. WHO, of course, is a crucial partner to the government, to governments around the world. In fact, as we all battle COVID-19, so far, Poonam, what is the WHO's perspective on the steps that India has taken to control the pandemic? We've had about 3 versions of the lockdown, over 50 days of a lockdown, nationwide lockdown in India. And now, as we look at slowly bringing business back on track and we try to balance lives with livelihoods, what are some of the strategic steps that India needs to keep in mind over the next 4 to 6 week period in particular?
India, as we know, has been recognized the world over of having started very well in handling the pandemic, and we are aware of the measures they took right in the beginning. They came in very early, and I think that was a good thing that was done. There were interventions which helped, apart from a very robust contact tracing to the lockdown, which also was considered to be essential at that time. We do feel in WHO that yes, now there is a stage where one has to take a decision on if the lockdown is opened, how should the transition be? And therefore, we are of the view that it should be a gradual kind of transition, which India is doing at the moment. Red zones have been identified. We find that the pressure is really in the urban areas. That is where the vulnerabilities exist. And therefore, that is an area which needs to be focused on. 8 such metropolitan urban areas have been identified. And India is now moving on it as we talk. We know the Prime Minister is already consulting the CMs of different states to decide how this should be done. So this whole approach, I think it's not a question of lives. Should it be lives or livelihoods? There has to be a balance between both. There are those that are affected, and we as a country and India as a country needs to see that the very poor are helped out of this situation. Therefore, there is a situation now before India, and it's a tough situation, to decide that how should this transition to normalcy be. There has been a little opening of late, like there are some essential services which have opened, and we do hope that some more will be opened, so that gradually those who are without livelihoods do get a chance to earn their living. That we believe is the right way to go, and that is the way India is going at the moment.
Okay, also I want to bring in Dr. Ambrish Mithal at this point. Dr. Mithal, in India, over 50% of all deaths due to communicable diseases in 2018 were due to respiratory disorders and pneumonia in particular. In addition, we have been in the recent past christened as the diabetes capital of the world. So in that sense, would you say that Indians are at a much higher risk of contracting COVID-19? On the other side, we've also been hearing that since we are a young nation and we have the demographic dividend on our side, we are perhaps better placed than a lot of other countries to battle this disease as well.
This is a very fascinating question, Ridu, because the data that's coming in from UK is actually showing the South Asians are the most prone. In a recent study, the average age at admission, hospitalization for South Asians was 61, whereas it was 77 for white Caucasians. The percentage of people who were diabetic in the population admitted in UK in the South Asians was 48%. and it was 28% in the Western Caucasians. And overall, the mortality was more than 1.5 times higher in South Asian populations. So on the one hand, we are saying that in the UK, South Asians seem to be more prone to serious effects of the epidemic, which may be logical because, for example, diabetes is almost double in them as compared to native white Caucasians. Here, on the other hand, we are seeing something very, fingers crossed, something very encouraging. I don't think the serious disease component here is as high as we would have thought. Yes, I do think Indians are intrinsically going to be, if we get affected more and more, we will get more serious disease. Remember, at the age of 60, in metros like Delhi, Bombay, Chennai, almost 40% population is already diabetic. So if you're talking of people at 65, 70 being in any case at much greater risk, almost half of them may be diabetic. So really, if it starts affecting that segment of population in our country, I think we'll be in trouble. But so far, it seems that we've been quite lucky with this. So I hope that continues. And I don't think scientists clearly understand the reasons for the differences, and we can discuss this as we go on. The real reason why South Asians in UK should behave differently from Indians in India.
Right. And Dr. Priya, if I can come back to you, the pandemic numbers, especially from the US in terms of fatalities as well as the positive cases, have really been terrifying. Do you think it could have been handled better by the government? They didn't really take it very seriously at the outset. So did you lose out on precious time at that point in time? And what's the near future looking like?
So definitely there were a lot of missteps in the United States. We had a nice window of opportunity of over 2 months where things could have been put into place, both for testing and contact tracing, limiting the spread of infection. And we missed that window. And primarily because testing was delayed by so much, we ended up with huge numbers of cases in our major metropolitan areas in Seattle, in California, and then of course New York, which has become the epicenter in the US. So the lack of testing, we had this sense of security that we actually didn't have cases, when now it appears that we definitely, as early as January, had a number of cases and community transmission happening even at that time. So the lack of testing was one thing. The lack of sounding the alarm that, you know, hospitals really are going to get surges of cases and that you need to be prepared was also a problem. And that was what led to the huge numbers of deaths in New York, because the medical system just quickly got overwhelmed, and we're not able to provide good medical care in the ICUs. And the third thing, which, you know, really as an infection prevention person is very, very disheartening, is the lack of PPE. In the United States, which is, you know, got a lot of resources, not having adequate PPE, having to reuse things that we have never had to use more than once in our hospitals, and lack of training for the staff and how to put on and take off their PPE were huge missteps in the US.
Right. And Professor Reddy, final question to you. Is India really prepared? Is our public healthcare system really prepared for the pandemic, you know, the peak that's perhaps coming our way over the next couple of months? And is it time to perhaps rope in the private sector in a much bigger way and put those public-private collaborations in place? What are those looking like at this point in time?
Well, I think we have spent a fair amount of time during the lockdown in preparing. Even earlier, I think once we started the containment measures, even by middle of January, and then stepped them up by February, I think the preparations went up. We too faced several challenges in getting access to testing kits as well as personal protection equipment. But I think over a period of time, we have actually garnered the resources. Ultimately, a response to the pandemic in any country depends upon recognition, resolve, resources, response, and resilience. Resources, we have not had a plenty, but there was early recognition, there was clear-cut resolve, and we have garnered the resources. We have provided a stepped-up response in different stages. And now I think we'll have sufficient resilience if the virus decides to strike back with ferocity later in the year, but we still have to maintain our vigil even till that time. So I believe we need to, even in the post-lockdown period, maintain physical distancing, masks, as well as hand hygiene, and ensure that we do not give the virus a free highway to speed around.
Right. Well, thank you very much, Professor Reddy. And it's a wrap of this conversation on CNBC TV18's television platform. Thank you very much for joining us today. Mindmine Mondays will be back next time. Thanks for joining us. Goodbye.
Presented by Bain Capital.
Focus. Ideate. Innovate. Enable.